Now to COVID coverage. And as the Delta variant continues to swarm the Gem State, it's impacting younger, healthier populations who are unvaccinated. Governor Little has used data to roll out the National Guard in order to assist hospitals, and is another push for Idahoans to get the shot. He spoke about it this morning on Viewpoint with our Doug Petcash following a trip last week he made to the St. Luke's ICU in Boise. Katya Stepovic joins us tonight with the report. And Katya, what's he saying about that visit to the ICU? He was very emotional in his press conference last week.
Well, absolutely. Governor Little described the ICU unit as heartbreaking when he saw all of the patients intubated. He said the average age of patients in the ICU was 43 years old.
Heartbreaking. The patients, they're all intubated.
Governor Brad Little recalls his emotions after visiting St. Luke's ICU in Boise just days ago.
But particularly the staff, how overwhelmed they are, how much trauma they see, patients dying. And it's really heartbreaking when you've got pregnant women and women with small children and spouses, they can't be with their loved one at this time.
He says the capacity in the ICU is not sustainable and the demographics inside the hospital are trending younger.
The last time we had a big surge, it was older patients, and now it's younger patients. But these younger patients that we weren't as concerned about 12 months ago are now the ones that are showing up as fatalities.
And yes, he says most of them are not vaccinated.
It's, again, very discouraging that people that are not vaccinated are tying up their healthcare capacity.
Little says he worries about the well-being of nurses and respiratory therapists. But here's his response when asked if he would implement a mask mandate to slow the spread.
No, but there were a lot of things that were different back then. And the hospital administrators were calling me and say, we don't have more than a 3 or 4 day supply of adequate face coverings. We can't operate if we don't have that. But I see absolutely no reason that it would happen now. But we have to be adaptive to how this virus mutates.
Governor Little also said when it comes to mask requirements in schools, it would be more effective if local school districts took it upon themselves to implement a mandate. He also pointed to Idaho's rising vaccination rate and says that needs to continue if we want to take pressure off of the hospitals.
I've always hypothesized that given Idahoans' general skepticism about a lot of things, that it would take some time. They're going to have to see their neighbors, their friends, their communities be thoroughly convinced. And that's what we try and do over and over every day to convince people that the vaccine is safe, it's effective, and it will be in everybody's benefit.
Now, the state actually changed how it calculates ICU capacity on Friday to include whether these beds are appropriately staffed. Now, as of Friday, there were just 23 open beds across the state. Terrible, Mark.
Yeah, those that work in the hospital say they're seeing bigger numbers now than they did at the height of the pandemic last December. It is concerning. Katya, thank you.